What if I told you that sitting in your kitchen cabinet, or maybe on a shelf at your local market, there is a bottle of something so powerful that it has been used for thousands of years to fight pain, calm inflammation, and slow down the visible signs of aging? And most people are using it completely wrong or not using it at all. Tonight, before you go to bed, I want you to think about what you are actually putting on your skin, because what you apply to your body at night while you sleep is not just sitting on the surface. Your skin is the largest organ in your body, and it absorbs, it takes in. And if you choose the right oil and apply it the right way at the right time, the results can be genuinely remarkable. I am Dr. Tasuku Honjo, and today I want to walk you through the science, the history, and the real evidence-based truth about what happens to your body when you rub a specific oil on your skin every single night. We are going to talk about pain, we are going to talk about inflammation, and we are going to talk about aging, because all three of these things are connected in ways that most people never fully understand. So stay with me, because by the end of this video, you are going to look at that little bottle of oil very differently. Let us start with something fundamental. Your skin is not a wall. People think of the skin as this thick barrier that keeps everything out, and while it does protect you from many things, it is also semi-permeable. That means certain molecules, especially small, fat-soluble ones, can pass through the outer layers of the skin and get into the deeper tissue, into the blood vessels, and even into the lymphatic system. This is actually the entire science behind transdermal medicine, patches that deliver hormones, pain medication, and other compounds directly through the skin. So when we talk about rubbing oil on your skin, we are not just talking about moisturizing the surface. We are talking about delivering bioactive compounds into your body through one of the most accessible routes available to you. Now, the oil I want to focus on most deeply today is one that has been studied extensively, and that is black seed oil, also known as Nigella sativa oil. But I also want to talk about a few others, including frankincense oil, rosehip oil, and the one that almost everyone knows but most people underestimate, coconut oil. Each of these has a different mechanism, a different strength, and a different role to play. And when you understand how they work, you will be able to choose the right one or the right combination for your specific needs. Let us start with black seed oil because the science behind it is nothing short of extraordinary. Nigella sativa has been used in traditional medicine across the Middle East, South Asia, and North Africa for over 2,000 years. The Prophet Muhammad, peace be upon him, is recorded as saying that black seed is a remedy for everything except death. For centuries, that sounded like folklore. But modern science has started catching up, and what researchers are finding is genuinely remarkable. The active compound in black seed oil is called thimaquinone. Thimaquinone is a powerful antioxidant and anti-inflammatory agent. When it penetrates the skin, it inhibits the production of certain inflammatory cytokines. These are the chemical messengers that your body uses to signal inflammation. Now, inflammation is not always your enemy. Acute inflammation is your immune system doing its job. But chronic low-grade inflammation, the kind that lingers in your joints, your muscles, and your skin, that is what causes pain that never quite goes away. That is what accelerates the aging of your skin, and that is what contributes to conditions like arthritis, eczema, psoriasis, and even deeper systemic diseases. Studies have shown that when black seed oil is applied topically, people with joint pain, particularly knee osteoarthritis, experience significant reductions in pain scores. One study published in a peer-reviewed journal followed patients who applied Nigella sativa oil to their knee joints twice daily. The results were comparable to the pain relief seen with topical diclofenac, which is a pharmaceutical anti-inflammatory gel. Think about that for a moment. A natural oil applied to the skin, delivering pain relief comparable to a prescription-level topical drug without the side effects. That is not folklore. That is science. But the benefits do not stop at pain. Let us talk about what chronic inflammation does to your skin as you age. One of the primary drivers of what we call inflammaging, a term scientists use to describe inflammation-driven aging, is oxidative stress. Free radicals, which are unstable molecules produced by sun exposure, pollution, stress, and poor diet attack your skin cells and break down collagen and elastin. Collagen is what gives your skin its firmness. Elastin is what gives it its bounce. When you lose these, you get wrinkles, sagging, and that tired, dull appearance that so many people try to fight with expensive creams and procedures. The thymoquinone in black seed oil is one of the most potent natural antioxidants known. It neutralizes free radicals, reduces oxidative damage, and in doing so, protects the structural integrity of your skin from the inside out. Now let us move to frankincense oil, or more precisely, the active compounds in frankincense, known as boswellic acids. Frankincense has been revered for thousands of years, used in religious ceremonies, traditional medicine, and skincare across ancient Egypt, India, and the Arab world. Modern research has confirmed that boswellic acids are powerful inhibitors of a specific enzyme called 5-lipoxygenase, which is a key driver of the inflammatory cascade in the body. When you apply frankincense oil to your skin at night, it works at this enzymatic level to interrupt the cycle of inflammation. For people with skin conditions like rosacea, eczema, or any form of chronic skin irritation, this can be a genuine game changer. But it also works for pain, particularly the kind of deep, aching joint pain that seems to have no end. There was a clinical trial, a properly randomized placebo-controlled trial, that looked at the effects of a boswellic acid preparation on knee pain. Patients reported significant improvement in pain, stiffness, and physical function within a matter of weeks. And the beauty of applying this through the skin is that you are delivering the compound directly to the affected area. You are not sending it through your entire digestive system, where much of it can be lost or altered. Topical application is targeted, it is direct, and it works. Now I want to talk about something that very few people discuss when it comes to nighttime skincare, and that is the concept of the skin's own circadian rhythm. Your skin, like every organ in your body, operates on a biological clock. During the day, your skin is in defense mode. It is protecting you from UV radiation, pollution, and environmental stress. At night, when you sleep, your skin shifts into repair mode. Cell turnover increases. Collagen synthesis speeds up. Blood flow to the skin intensifies. This is why what you put on your skin at night matters so much more than what you put on it during the day. When you apply the right oil before you sleep, you are working with your body's natural repair cycle, not against it. You are giving the skin the tools it needs at the exact moment it is ready to use them. This brings me to rosehip oil, which is one of my favorites for nighttime use specifically because of its effects on skin aging. Rosehip oil is extracted from the seeds of rose bushes, and it is remarkably rich in trans-retinoic acid, which is the natural precursor to retinol, the gold standard ingredient in anti-aging skincare. It is also rich in vitamin C, vitamin E, and essential fatty acids like omega-3 and omega-6, which are critical for maintaining the skin's barrier function. When you consistently apply rosehip oil to your skin at night, the trans-retinoic acid works to stimulate collagen production, accelerate cell turnover, and fade hyperpigmentation, dark spots, and the remnants of acne scars. Multiple clinical studies have shown that rosehip oil significantly improves skin texture, reduces the depth of fine lines, and brightens uneven skin tone, all with consistent nightly use over a period of 8 to 12 weeks. This is not overnight magic. This is biology working on a timeline. But the results are real, measurable, and lasting. Let us also address pain from a different angle for a moment. Muscular pain and the kind of tension that builds up in the body from stress, physical activity, or just the wear and tear of daily life. When we talk about pain relief through topical oils, we cannot skip over the role of arnica oil and peppermint oil. Arnica contains helionolin and other sesquiterpene lactones that reduce bruising, swelling, and muscle soreness when applied topically. Athletes have used arnica for generations, and research backs it up. Studies show that arnica gel is as effective as ibuprofen gel for reducing pain in osteoarthritis of the hands and for post-exercise muscle soreness. Peppermint oil, on the other hand, contains menthol, which activates the cold-sensitive receptors in your skin. This creates a cooling sensation that essentially competes with pain signals, reducing the perception of pain through a mechanism called counter-irritation. But beyond the sensory effect, menthol also has mild analgesic and antispasmodic properties. It relaxes muscle tension and can bring real, measurable relief to headaches, back pain, and sore muscles when applied to the skin. Now, I want to be honest with you because I think honesty is the most important thing I can offer you as a doctor. Not every oil works for every person. Not every oil is safe for every skin type. Some people are allergic to certain plant compounds. Some oils can clog pores if you have acne-prone skin. Some oils, if used undiluted, can cause irritation or sensitization. So I always recommend doing a patch test. Apply a small amount of any new oil to the inside of your wrist, leave it for 24 hours, and check for any reaction before using it more broadly. And if you are pregnant, breastfeeding on any medications, or managing a serious health condition, please talk to your doctor before adding any new topical treatment to your routine. I also want to address the question of carrier oils versus essential oils, because this confusion trips people up constantly. Black seed oil, rosehip oil, frankincense oil in its expressed form, and arnica oil are all carrier oils. They are safe to apply directly to the skin. Essential oils, however, like peppermint, lavender, eucalyptus, and frankincense essential oil, are highly concentrated plant extracts that should almost always be diluted in a carrier oil before applying to the skin. A good rule of thumb is 2 to 3 drops of essential oil per teaspoon of carrier oil. That gives you a safe, effective dilution that delivers the benefits without the risk of irritation. Let me tell you how I would structure a nightly oil routine if I were recommending it to a patient who wanted to address all 3 issues, pain, inflammation, and aging, at the same time. Before bed, after washing your face and body, I would suggest warming a small amount of black seed oil in your palms, just enough to cover the area you are treating, and massaging it gently into any joints or areas of chronic pain or inflammation. Take your time with this. The massage itself increases blood circulation to the area, which enhances absorption and adds its own therapeutic benefit. Then for the face and neck, I would recommend mixing a few drops of rosehip oil with a drop of frankincense essential oil and massaging it into your skin using upward, circular strokes. This combination targets both the inflammatory drivers of skin aging and the structural loss of collagen that makes skin look older over time. If muscle tension or soreness is part of your picture, a diluted blend of peppermint oil in a carrier like coconut oil massaged into the shoulders, lower back, or sore muscles before sleep can make a profound difference in how you feel when you wake up. Consistency is everything here. I cannot stress this enough. The people who see transformative results from natural topical oils are the people who use them every night without skipping. Your body does not change overnight, but it does change steadily, week after week, when you give it the right inputs at the right time. Think of it the way you think about diet or exercise. One good meal does not make you healthy, but a pattern of good nutrition over time absolutely transforms your body. The same principle applies here. One more thing I want to leave you with today, because I think it is important context. We live in an era where we are surrounded by synthetic creams, pharmaceutical-grade topicals, and a billion-dollar skincare industry that profits from your insecurity and your pain. I am not saying those things have no value. Some of them are genuinely effective. But what I am saying is that nature has been providing compounds that work with the human body. Compounds that human biology has co-evolved with for thousands of years, and we are only now catching up scientifically to confirm what traditional healers already knew. Black seed oil, frankincense, rosehip, arnica, peppermint, these are not trends. These are ancient medicines with modern scientific validation, and they are available to almost everyone at a fraction of the cost of the products that dominate pharmacy shelves. So tonight, before you go to sleep, I want you to try something. Pick one oil, just one. Start with black seed oil if you have joint pain or inflammation. Start with rosehip oil if your primary concern is skin aging. Start with diluted peppermint oil if you are dealing with muscle tension or soreness. Apply it with intention. Breathe. Let your hands work slowly and deliberately. And then sleep. and let your body do what it was designed to do, which is heal itself. I am Dr. Tasuku Honjo. If this video gave you something valuable today, please like it, share it with someone who is dealing with pain or inflammation or who wants to take better care of their skin, and subscribe to this channel because we talk about the real science of health here. Not the headlines, not the hype, but the evidence. I will see you in the next video. Take care of yourselves.